I'm Darcy, one of the pharmacists with Red Cross Drug Store. I'd like to thank you for joining our Wellness 101 presentation on pain. I'd like to give a special thank you to our student, Shanna Riamundo, who helped us create this presentation. So today we're going to actually go through these slides rather quickly as there's a lot of data to cover. We're going to focus on the classifications of pain and how to treat pain both with medication and without. If you'd like to slow down and pause, you're welcome to, so that you can explore some of these slides in a little more depth. Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. Pain affects a lot of people at a great cost to our society and reduces the quality of life. So how can we decrease it or prevent it? And how does our body interpret pain? So there are 4 different pain processes: transduction, transmission, perception, and modulation. And there are 4 different nociceptors for pain. There's heat, chemical, pressure, and cold. There are a lot of inflammatory mediators that increase pain through inflammation. And there are a lot of neurotransmitters that both excite and inhibit our neurons for nerve pain. This is a classic pain scale that is very helpful to us for when you are describing your pain. And how are the different ways that we classify pain? So we can classify pain by the physiology, if it's nociceptive, inflammatory, neuropathic, or idiopathic. We'll go into those in a little more detail. And we classify pain by how intense it is with that pain scale we looked at: mild, moderate, or severe. We can refer to pain by the time course, whether it is acute or recent pain, or whether it's chronic that has lasted a long time. We can classify by the type of tissue that the pain is located in, and by various syndromes that are known to cause pain. What is nociceptive pain? It's the normal response to a noxious insult or injury of the tissue. It's often an acute injury, like muscle sprains, tears or pulls, or back pain, or cuts or burns or contusions, or internal injuries. Inflammatory pain is a very common source of pain that we deal with. It's the result of all those inflammatory mediators that we looked at a couple slides ago, releasing at the site of the tissue, causing inflammation and causing pain. These are things like arthritis, ulcerative colitis, or gout. How about neuropathic pain? So it is caused from a sensory abnormality from a lesion or disease in the nervous system. How about idiopathic pain? It is pain of an unknown origin with an increase in sensitivity to noxious and non-noxious stimuli. It's often used to define chronic pain that has no identifiable cause or remains long after the injury has completely healed. Examples of this are fibromyalgia or multiple sclerosis. We aren't going to spend any time today talking about a particular medication that we have in the pharmacy compounding lab that can be very beneficial for these 2 kinds of pain, fibromyalgia or multiple sclerosis. It can be helpful for anything autoimmune or inflammatory in nature, and sometimes life-changing for some people. So if you have any of these autoimmune kinds of pain, please come talk to us. The earlier you talk to us in these pain conditions, the more dramatically we can help. What is a characteristic of chronic pain? It's elicited by a low threshold, and it spreads beyond the area of injury, is amplified with repetitive stimuli. It's a very vicious cycle that people deal with chronic pain, with anxiety, sleep disturbances, and depression being part of that cycle. How do we reduce pain without medication? So if you're talking about an acute or a recent pain, RICE helps: rest, ice, compression, elevation, and potentially braces or immobilization to allow the area to heal itself. This Arctic Ease cold wrap that you see pictured here is a fantastic product that we have at Red Cross Drug. The product is just kept at room temperature. The moment it comes into contact with our skin, it becomes cold. So you're able to do compression and cold to an area of injury with a product that is kept at room temperature. It's a really, really great product. With chronic pain, we can also use the cold compression, but we can also benefit from manipulation such as chiropractor, massage, acupuncture, or physical therapy. These have all been shown to be very helpful with dealing with chronic pain. Also, TENS units, or the electric nerve stimulation, have become very readily accessible and are also very helpful with chronic pain. Nutrition is a very, very important part of how to reduce pain. Every person that I have come into contact with that has dramatically changed their diet and gone to low glycemic foods, high antioxidants, and healthy fats has had a dramatic improvement in their pain. Also with exercise, we hear a lot of great feedback. I know with arthritis a lot of times people feel like the pain prevents them from exercising, and once again, all of the people that I've come in contact with that we encourage the light to moderate exercise, once they push through that initial pain, they always feel better. And so yoga, stretching, aerobic exercise can all be very beneficial at decreasing inflammation and raising serotonin levels, which definitely helps diminish pain. This is a very, very valuable food guide. You really want to try to increase the amount of anti-inflammatory foods that you're eating and decrease the pro-inflammatory foods. I would really encourage you to take a screenshot of this so that you can really focus on making these changes. And as long as we're talking about food, it's important to recognize that pesticides do not help pain. So they also are just not generally good for our health. So on these Dirty Dozen that you see on the top, please either buy organic or always, always, always wash with something like Dawn dish soap and then rinse it really well. There are a lot of supplements that can help with pain, so we're going to go over some of those individually. Omega-3 fatty acids can be very helpful for decreasing inflammation. You can see some of the doses here. Turmeric or curcumin is also very helpful at decreasing inflammation. We get lots of great feedback from people using this product to reduce their pain. Alpha-lipoic acid can be very beneficial with neuropathy. Magnesium glycinate can help with neuropathy and also muscle-related conditions such as restless legs and muscle spasms, as well as decrease the frequency and severity of migraine headaches. I definitely want to point out here that magnesium oxide is very inexpensive and readily available at any pharmacy. Is a very, very poor form of magnesium supplementation. A lot of times it's recommended by practitioners just because in some pharmacies it may be the only kind of magnesium that's carried. We do carry magnesium glycinate, a Red Cross drug. The absorption is dramatically better while decreasing the amount of oxidative damage to the tissues that magnesium oxide perpetuates. Methylcobalamin can help with nerve pain. Melatonin can decrease inflammation, and it helps improve sleep, which also reduces pain. L-carnitine is an amino acid that can help with neuropathy, fibromyalgia, migraines. Coenzyme Q10 is a great antioxidant that can help decrease pain. We carry a high absorption formula at Red Cross Drug that is a much better value. 30 milligrams of our high absorption formula is equivalent to 240 milligrams of a standard form of CoQ10. Vitamin D is very, very important for decreasing inflammation and is really helpful in people with chronic pain. It also has the advantage of decreasing every kind of cancer and helping protect your body against viruses such as flu. So anytime you're seeing your doctor for a routine visit, encourage them to check your vitamin D levels. You want to be about 55 to 85 to be in the ideal zone of vitamin D. Glucosamine, chondroitin, and MSM are very helpful for decreasing inflammation. We usually like to try them after we have tried some of the other things we've talked about, as glucosamine does increase the risk of type 2 diabetes. How do we treat pain with medication? It's very individualized, and it may not ever reduce pain 100%. We're hoping to reduce the pain significantly. We're going to try to reduce the cause of the pain by decreasing inflammation and also decreasing nerve stimulation. So oral medications do have a lot of side effects, especially the anti-inflammatories out there. They really have gastrointestinal side effects, potentially kidney or liver damage. And some of the medications out there cause sedation and decreased cognition. And those medications usually also have abuse and addiction as a side effect as well. And then there's always the lack of results that potentially exists. We can do topical pain creams. Why would you want to do that? Because we can customize the dose just specifically for each person, and we can combine different medications to help them work together synergistically or in a stronger way than they would alone. And for very little additional price, we can combine medications together. It gives you a more localized treatment right in the area of the pain. Doing a cream topically bypasses metabolism, so we can get away with a much lower dose. We can minimize the side effects and have less abuse and addiction risk. So topical formulations, what can we put in them? Anti-inflammatories, and then here are some examples and some doses. We can do anesthetics to just numb the area. We can do sodium and or calcium channel blockers for nerve pain. We can do NMDA channel blockers also for nerve pain. Tricyclic antidepressants can help with a wide range of pain, and here are some options and dosages. Muscle relaxants can be very beneficial for pain involved with muscle or even nerve pain. There are a lot of other agents that can help specifically with different kinds of pain. So here are some of those. The bottom line is we can help. It really helps if you can give us a complete history of how the pain originated and what kind of pain it is, as well as really specific information on where it's located. And that helps us determine the best combination of agents to use. We do expect you to feel a significant response from our custom-made compounds, so please feel free to talk to us about how we can help make modifications to improve the results. Thank you very much for taking the time to listen to this. If you're interested in one of our custom formulations, please give one of our pharmacists a call, and we can definitely help you in reducing your pain. Thank you, and have a great evening.